So arthritis, in its simplest terms, is inflammation of a joint. However, typically when we diagnose a patient with arthritis, we're discussing the loss of cartilage and cushion that it occurs between the two bones at an articulation or a joint. Within the foot and ankle, you can have the normal wear and tear arthritis or osteoarthritis, like what we see typically in the hip and the knee. In addition, you can have rheumatoid arthritis that affects the foot and ankle, or other inflammatory types of arthritis. Specific or unique to the foot and ankle, the majority of arthritis is actually post-traumatic. So after a fracture or a trauma, car accident, it is uniquely has higher rates of post-traumatic arthritis than hips, knees, and other parts of the body. So the typical symptoms we see with arthritis are pain with activity. They can have some grinding type pain, inflammation, and stiffness a lot of times they'll experience as well. When someone comes in for arthritis, we typically like to start with non-operative, or what we consider conservative management. So that'll be anti-inflammatories, bracing, physical therapy, things that carry a lower risk than surgery. So we typically will start with physical therapy to try to maintain the motion that they do have, or improve the strength and stability via the ligaments and tendons surrounding the ankle. In addition, we can try injections to decrease the inflammation and help with pain control. With the injections, a lot of times we're injecting a numbing medicine like a lidocaine in addition to a corticosteroid to decrease the inflammation. So the lidocaine will numb the ankle up for the corticosteroid to take effect. Usually the corticosteroid takes effect within a couple of days and then can last for 3 to 4 months. And we can repeat those every 3 to 4 months as long as they continue to be effective. We can also try bracing to limit the motion of the ankle and to eliminate some of the pain or symptoms that the patients experience when they're walking or being active. Other options would be anti-inflammatories to try and control the inflammation, and whether that be oral or topical. We can sometimes consider different types of shoe wear or orthotics to see if that can help as well. And then if all of that fails, then that's when we kind of have a discussion about surgical intervention to treat the condition.